Thank you, Bhavna, and thank you everybody for joining us. And I've started the recording, so Bhavna, all yours.
Okay, so welcome everyone who's joined us again today in our series of 7 sessions on fibromyalgia management and well-being. My name is Bhavna Patel, Director of Fibro-Focus, and I'll be guiding you through this throughout the journey of the sessions. So with this, I want to express my gratitude to Dr. Neha again from Aragyam UK for welcoming us to this platform. And today we're actually joined with a guest speaker, Prabhubai Shah, who we will interact and discuss and have a conversation with him later. He specializes in yoga therapy and pain, so it's an ideal guest to have on today's show and such an honor. So let's have a quick recap on fibromyalgia in a whole for everyone, for those that didn't join last week and are new to this platform and condition. So fibromyalgia is a complex condition that affects individual in different ways. We're all different people. And in these sessions, we talk about fibromyalgia and how it impacts individuals on their daily life. And because it is complex, it contributes to not only the widespread pain that we experience or the individuals experience, but the severity of it. So it can be from moderate pain to severe excruciating pain that causes just undue discomfort that sometimes can be very unbearable. So we'll be exploring the symptoms, which is widespread pain, but there's also fatigue, sleep disturbances, and we also have cognitive difficulty. So sometimes we're thinking one thing, doing another. We sometimes can say that it's normal life and that's how we live, and that's what we experience as we grow older. But when you are a fibro sufferer, it's such a different feeling. It's nothing in comparison to the normal getting older syndrome. Now, symptoms like morning stiffness, when you have arthritis and other conditions, fibromyalgia does mimic some of the conditions, and it is so frustrating. And I think I mentioned this last week, to a point where you don't know whether you are struggling with one condition or is something else new that's happening. We also talked about headaches and other pain other than headaches. So TMJ comes into it, which is you have a nerve pain on the side of your face. Neuralgia, which is also a nerve disorder. So it's basically you just have to go to bed. You cannot cope with it. Additionally, diagnosing fibromyalgia is difficult in itself. But to get the accurate diagnosis, you do need to see a rheumatologist that you'll be referred to by your GP. Now, Fibro-Focus deals with supporting individuals with fibromyalgia, whereas Aragyam UK focuses on promoting overall well-being through various initiatives and resources. Now, as a community, we believe that we could greatly benefit from these services. The resources that Aragyam offer, particularly, if they've given 40 plus groups that you can join, and it's fabulous because you can pick and choose and make your own little toolkit. So again, welcome to our second session, focusing on pain management technique. So in today's session, we're aiming to provide education and support for for individuals affected with fibromyalgia. Now, I'd like to sort of mention that we can all have our own approach, and we take on board throughout these discussions and sessions what suits us. The sessions will last up to about an hour, 45 minutes to an hour, and we always have a Q&A at the end, so please hold on to your questions till the end. So I also want to let you know that I'm not clinical, so I'm unable to answer any medical specific questions, but please, you know, I can only go by my own experiences to share and see who resonates with it. So today's session, like I said, is pain management techniques. We at Fibro-Focus understand that living with fibromyalgia often involves managing chronic pain, which can be very, very challenging, like I said earlier. So the techniques today, there's a few that we'll be talking about, but we'll also be discussing about conventional medicine that's used commonly for fibromyalgia. But we also want to approach with a holistic approach that helps with relaxation techniques, such as acupuncture and yoga. So with fibromyalgia, it's real, it's not in the mind, and realistic to the point that the feelings, the pain that we discover as cope with as individuals can be overwhelming sometimes, and sometimes it's so hard to find a strategy and to overcome the challenges that individuals go through. Now, in pain management, and I am sure that some of you who are diagnosed with fibromyalgia and plus another condition, you will more than likely be diverted to pain management to do maybe a 6-week course. And from that, you learn enough to take away as a toolkit. And then from there, it's up to us how we then go about it. And they talk about pacing activities and practicing some self-compassion, you know, bring back the love back to yourself, because that does help. We often forget about how to love ourselves because we spend so much time on looking after the family and everyone else that we put ourselves on the back burner. But we are important. You as an individual, if you're not okay, then it's difficult to cope with the surrounding environmental stresses as well. It's essential to experiment with different therapies and techniques to find what works for you. So remember, don't hesitate to ask for help. If you don't ask for help because you feel that, oh, you don't want to be a nuisance, or, you know, you've been through all the streams and the process of seeking for help that you've lost the will, trust me, you know, you get sent to every O-ology, and it's just part of the process, unfortunately, because it's such a complex syndrome and it mimics so many other conditions. So, for example, if you have fibromyalgia but also diabetic, you will find that, are you struggling with peripheral pain or nerve pain from the fibromyalgia, or is it actually something to do with the diabetes? And this is where it is really important to maybe keep notes on how you're feeling, so that when you speak to somebody, it's easier to explain how you're feeling or how you have felt. And I'll talk about that a little bit later. Now, abnormal processing. So fibromyalgia is basically, the science behind it is about abnormal processing of pain signals and the nerves in the brain. So the brain doesn't register pain, and it also leads to heightened pain, meaning it's more than what it is. Now, when someone tells you that, sometimes you think, would you like to wear my pain for the day and see whether it is real or not? Because when they say it's heightened, it is heightened, but it's super, super sensitive to the point that, you know, it gets to the stage where I know my personal journey where when my children want to hug me, they have to pre-warn me that, Mom, I'm going to give you a hug. Just that, you know, it's like you're having to compose yourself to deal with that, but it's real. It is real. And that's how it is, because you're super, super sensitive to pain and various other environmental things like, you know, central heating even maybe. It's not even hot in the room, but it's causing you pain. Something in that room is causing pain. So is it too cold? Is it too hot? And then it heightens that widespread pain. Now, again, everyone experiences a different journey through fibromyalgia. Different types of pain associated with fibromyalgia. Types of pain that you experience. Well, let me reflect on what I've been going through. Men, obviously, they do have fibromyalgia as well, but I can assure you, sometimes it has been where you feel as if you're having a baby every day, you're in labor, and it's excruciating. Your legs hurt, your lower back hurts. And then there are some days where you feel that you just can't pick your arm up or your leg up, and it's such an effort. And it feels like your body's going into some sort of paralysis, or is something happening to you? And when it's like that, not only is it overwhelming, but it's quite frightening as well. So that one side of your mind is saying to you, do I go to the doctors? Do I call an ambulance? Am I having a heart attack? Do you think it's a stroke? Oh gosh, is it a TIA? Where it might be a small stroke. There's all these things that trigger and go off, and yet you're just having a massive flare up. This is your body naturally telling you you've either done too much or you've done something to trigger it. Now, it can also be, pain can be triggered by an environmental or an emotional stress. So when someone has told you about, say, for example, a sudden passing of someone, and you're not mentally prepared. So someone, let me see, if somebody says to you, oh, so-and-so passed away, and this is how it happened, and it's like, whoa, yeah. Yes, you're not ready for it. Who is? However, it's how it's been told. Now, they don't know what you're going through. They don't know what you've got or what you're coping with. So being empathetic for them on the other side who's telling you this news, it's difficult for them. So in a nutshell, it's how we take this information on, which is also important, and how we process it, because it affects our body to a point where it puts you out of balance. And you can start tripping over things because you're not with it. And when I say you're not with it, I mean, your body's not registering. It's like you're hearing it, but you're not listening, or you're not listening and you're hearing it. It plays tricks on you. But if you master what you go through in pain and in times of severe pain, you can manage it very well. The benefits of medication. Now, we have fibromyalgia and medication. There's common medication that is prescribed conventionally, and they can be non-steroid. So they're known as non-steroidal anti-inflammatory drugs. So it's you'll see the letters NSAID, and they're used for pain relief. So sometimes you'll think, oh, they've given me an antidepressant, but I'm not depressed. But they use the same medication to help you because it calms your nervous system down. And that's what it's about. Now, you can do this naturally. And this is where the holistic side comes in. with meditation, with yoga, or just sitting quietly in your own space and getting to know yourself and composing yourself. Now, with other medication, so like I said, with antidepressants, they can use it for the peripheral nerve pain that I mentioned earlier. So if you're diabetic, they can prescribe you, for example, a medication called duloxetine. Now they use that effectively in fibromyalgia, but they also use it in diabetes. That doesn't mean, oh, you've got diabetes. They just use the same medication because it's proven to work with both. However, to make it work more effectively, you can have the holistic approach as well. And that doesn't mean taking potions and herbals and things. It's about composing yourself, to calm yourself so that the medication works, but also your nervous system is calmed down. Now, things like you may have heard or you may have been taking or prescribed medication like pregabalin and gabapentin, which are not specifically for seizures, or shall I say they can be, but when they use it with fibromyalgia, it's the same principle. They use it or you take it to calm your nervous system down because it's hyper. Your nervous system is overloaded, it's hyperactive, and your body's like, whoa, I'm in a fairground, please stop. And it's like these little voices will say, oh, I can't cope with this, but it's giving you that coping mechanism. And if you, again, work with yourself effectively, you can have your own toolkit. So let's talk about the non-pharmacological or pharmaceutical conventional medication treatment for pain management techniques. So we've got exercise, which is a physical therapy. We've got mindfulness. So mindfulness, it can be even mindful eating, because sometimes when your face hurts, your jaw hurts, your back of your head hurts, when you're eating mindfully, you're concentrating on the chewing motion. And then you'll find that even pain from that will start to subside and feel lighter than what it is. Complementary therapies are effective. Again, use it in conjunction with medication, if you please. I know that sometimes people don't want to take medication, but if you need something to fast track what you're trying to sort out, medication can sometimes help. And then you can wean yourself off when you have found something that works for you. But in that interim time, it is good to probably take medication. Otherwise, you'll have so many flare-ups and you won't know what you're doing. The other thing is lifestyle modification to alleviate pain. So the tips that I can give you is keep a diary again and make the essential changes that you need to do. So find what the areas that you're spending too much time, if it's worrying, then find out what you're worrying about. If you're wanting to lose weight, find out what's causing it. Sometimes you'll find that medication, and I've experienced it, we'll say, I'm putting on weight, but I'm not eating much. But what's happening is that your medication is increasing your appetite. That's the side effect. So what happens is that you're feeling hungrier and you eat, but you do it subconsciously. You don't even know that you're doing it. So changes are essential. And the role of alternate therapies, like acupuncture and massage in managing fibromyalgia with pain can be effective. And it's about integrating the care with medication to enhance the results with holistic approaches. So introducing relaxation techniques, again, meditation, it can be a morning ritual for you. And this is something that we'll talk about in session 7, about, making your plan of your day and how you're going to do things. And yoga, absolutely. You know, there's sitting, chair yoga, and I won't say too much about it because I'd like Prabhubai to talk about it in a minute. But this is, again, integrated care. So with medication, it's about having the comprehensive pain management that suits you. Again, please do not stop taking your medication without consulting your GP or specialist. And if you are taking any holistic remedies, please let them know so that they know, that you are taking it, and then they'll be able to support you more if you tell them. There's nothing wrong with it. It's just about being honest so that they know how to look after you in their care plan. The feelings are real, like I said, and understanding this constant pain and fatigue and feeling overwhelmed. We can look great on the outside, but trust me, I'm sitting here right now, and how long has it been? Half an hour nearly? And it's like, I want to move. It's like my body is saying, come on, move. Go for a walk, move around in the room. Are you sitting properly? There's this little voice saying, oh, do you want to move a little bit? It is as it is. That's fibromyalgia for you. But overcoming these challenges and creating your personalized pain management plan where you're pacing your activities and practicing self-compassion is important. Now, I mentioned about keeping a diary. So keeping a pain management diary. So when you're having a flare-up, it's great to note down when these flare-ups have happened, so you can write down what's happened in that week to establish what the cause was. So if you've been gardening too much and then you've had a flare-up, you know that either you've done too much. So what you need to do is then create a pace. So do little and often. Now, the diary also helps when you go for your appointment with your specialist or even a holistic approach, a therapist, because it's fast track, it saves time, it helps you to remember, what you want to say on the day. Because often we'll have an appointment that's 6 weeks away. By then you've slept and you've completely forgotten what you were going to go for the appointment for. So if you write it down in your diary, the specialist, the holistic coach or whoever will know, okay, this is what's been happening with them. This is the appropriate treatment for you. And it helps them. So you help them work as a team. It's an effective approach. And also don't hesitate to ask questions if you don't understand anything, because the worst thing is you go in that appointment that you've been absolutely waiting for, and then you'll go home and you think, oh, I wish I asked that. So if you write it down in your pain management diary, what to ask at your next appointment, you will go away feeling happier, more productive and wanting to do more to help yourself. Now, let's welcome Prabhubai Shah. Thank you for joining us today. And it's a pleasure to have you on this platform and sharing your expertise and your approach. So how are you today?
I'm fine, Bhavna. Thank you. Nice to be on the Zoom.
Yeah. Now, I'd like to ask you, I've got a few questions here, and I'm sure that people listening to this will appreciate as well, because I'd like to ask you questions with regards to your specialty. So can you explain how yoga therapy specifically helps individuals with fibromyalgia and helps them to manage the pain and to improve their overall well-being, please?
When in yoga therapy, there is breathing and acupressure. I use breathing and acupressure and some movements of your hands, movements of the body, basically. And then that helps to get the brain engaged. We need, because the brain is constantly listening to signals of pain. That's all it does. And because it's doing that, it can't do its other jobs.
Yeah.
And that's why, and then it's converting the signals to you, and you say, I'm in pain, I don't want to do anything. So basically, we to stop the brain thinking of pain, or brain sending the pain messages to you. If the brain is engaged, you can't do the other thing of sending the pain message to you. So we engage the brain. So firstly, I use acupressure. These are pain channels. At the back of the hand, in between each finger, is a pain channel. So you walk along that, or rub it, walk along it, in between all that, and that will reduce the pain, because you are engaged anyway.
Yeah.
You're doing some activity, but at the same time, this will reduce the pain signal. It might not reduce the actual pain, but the signal you're getting, because just keep a note of what's your pain level now and start doing this and see how far it falls.
So a bit like a score. So between 1 and 10, would you say, a before and an after?
Keep a note of your pain every day throughout the day. So then you know that this is my maximum, and this is I've improved. I'm down to 5 or 4, whatever. But get to know your pain level.
Okay.
As you experience, and then when you talk to others, you can exchange your pain levels, and then you can see.
Okay. So are there any, I know that it may be difficult on a Zoom, but maybe put it in the Fibro-Focus group, or, to help. But are there any specific poses with regards to practicing yoga that you'd recommend for fibromyalgia patients, and why? Because when you're in so severe pain and discomfort, you get put off. As much as people want to engage with yoga, I know there's seated yoga, but some people will say, well, I need somebody to come with me to my class because I can't get up, or I need support. How do you work your way around it? Is there something that you can recommend that you can do on your own without having to have the support and still enjoy yoga?
Not poses, but gentle movements.
Okay.
You try and do gentle movements, not heavy movements, basically, and then use it with breathing. So basically, first one you do is just breathe in. You just breathe in, hold your breath, 1, 2, 3, and then breathe out. Hold your breath, 1, 2, 3. Then again breathe in. So keep doing that. Then brain is engaged. Extra oxygen is, because you tend to breathe longer when you breathe in slowly through the nose. It goes into the lungs, and then into the heart and into the blood. So getting extra oxygen, because when you're in pain, you stop breathing. You're watching a horror movie, you stop breathing. You're not breathing. And that's why the body is complaining that all the muscles need oxygen going through the blood, and you breathe less because you are tired, you are complaining, you are moaning, groaning, crying, whatever, and you stop breathing. You breathe very little. It's same as I said, you're watching a horror movie or suspense movie, and that when the scene finishes for 5 minutes or whatever, you're not breathing, you're holding your breath. So, and then gentle movements, just open and close the fist, and then up and down, and then rotate the fist.
Yeah.
Gentle movements, and then neck movements, moving the neck, and then moving the eyes as well. Eye has got muscles. So taking your eyes up, back, side, down, and then turning your neck, left, right, back, down. That as well. And then if you can do this, both hands on the shoulders, movements is the thing. Whatever you can, up, back, down, forward. And then breathe in. Again, breathing is incorporated in this. So breathe in as the elbows are coming up. Breathe out as the elbows go down. And then do that in reverse. Little movements you can do sitting down, and then rotating the shoulders. Take them up, back, down, forwards. And then you go in reverse.
It's really good. Now, it's the what you've just demonstrated just now, it is doable, and it's something that you can do when you get out of bed. Because that's the
Anytime, yes.
time,
Yeah,
that's the
anytime.
time when you're really, I would say, you need that kind of exercise that you've just showed and demonstrated. And thank you for doing that, because
To
it
wake up
is,
the body, you have to wake up the body, get the blood moving.
yeah. Because when you're in pain, it's like walking on ice. That's the only way I can explain it. It's like, you know, when you're walking on ice, you're sort of like, oh no, I'm gonna fall, and you only half breathe. You don't
Well,
fully breathe, you don't
yeah,
belly
very
breathe.
anxious,
Yeah,
anxiety, afraid. And then, so brain is doing so many things. So how not to fall and how to control yourself and
yeah,
worrying about falling, and then the pain is just there. You're not helping, not sending oxygen to the muscles
yeah, yeah.
and your nerve endings. And
Thank
then
you.
the therapy I do is just stimulate the brain pituitary gland, and then all the sides, head massage,
Yeah,
sides of the eyes, sides of the head, then pull the ear, turn it down, and then massage this as the base of the nose.
yeah.
So keep the nostril clear as well.
Mhm.
And
Thank you. So what I'd like to ask now is, how does yoga therapy complement conventional medication in managing fibromyalgia and the symptoms? So what should individuals consider in integrating these approaches? So I don't think there's much, but I mean, you're the specialist here. So how, when you're taking medication and sometimes you feel, like I said, you know, how can we engage yoga when you're taking medication? Somebody that's skeptical about it, maybe.
again, do, do these exercises and do a lot of breathing.
Yeah,
Breathing is the pranayam part of yoga is very important. So you do the breathing, the simplest one with everybody does every day, but you just do it a little bit more. Just Vastrika, you just breathe in
yeah,
and breathe out through the nose. And the important thing is you breathe into the lungs. The lungs will expand. The lungs must expand so they become larger, absorb more oxygen, and then out. So do this 2 minutes, try and do 5 minutes if possible. Just this, even when you get up or even when you're in bed, deep breathing. And then there's alternate breathing.
yeah,
If you're able to move your hand, and then so you breathe in from the left nostril, breathe out from the right nostril, breathe back in from the right nostril and out from the left nostril. You don't move anything, just in
just
and
breathing in.
out, and then concentrate on the third eye in between the two eyebrows. Let the brain keep wandering. You keep breathing, preferably with the eyes closed if possible, and then keep doing that. Do as much as you can, no limit. And you can do this anytime. Anulom Vilom, you can
Yeah,
do anytime. And then another breathing technique is Kapal Bhati, which moves the stomach. Because you breathe out with a little force. You
yeah,
breathe out through the nose with a little force, the stomach moves in. As
yeah,
the stomach moves in, it exercises the organs. We are trying to make your organs healthy, make your immune system strong. If the immune system will fight the pain, fight the disease, fight the problems. And because with people with pain, they don't move, it causes other problems.
yeah,
The medication causes side effects. It causes other problems because you're not moving. There's no blood is not flowing slowly or less oxygen going into the body. So it's important to breathe even if you are in pain. Even if you are in pain, breathe longer. Breathing reduces the pain. Even in the hospital, they tell you, breathe, take deep breaths when they're doing procedures or when you're in pain. So deep breaths at any time to reduce the pain, control the pain. So these little things you have to do, and then it will become a habit. It will become automatic habit that you take deep breaths whenever you can. and Kapalbhati as well. And then another one is Brahmari Pranayam, where you hum like a bee. So you breathe in and roll your tongue up in the mouth. Put the tongue up to the roof of the mouth, and then you hum. With the tongue rolled up, you make a very deep sound.
Yeah.
We are vibrating the brain. The brain won't be able to divert its attention. It won't think about the pain. It will it will stop the pain, and you'll feel the pain going down. And you can do it with the eyes closed as well. And one finger there, 3 fingers on the eyes.
A good way of a distraction of pain, isn't it? But also a healthy way.
Very simple, and we can do without exerting too much pressure.
Yeah.
And then another technique, you just turn around. Turn your head and shoulders. Turn around, take your hands with you. Hands go down and push them down. Turn around. So you're exercising several points, your neck, shoulders, your organs. As you twist your waist, you're squeezing the organs.
Yeah.
Again, you're making the organs healthy without doing Kapalbhati. So that's just turning. And then if you have shoulder pain, if you know Kapalbhati, if your shoulder pains, you join your cross your elbows, then open your palms, then bring back the palms facing each other. So first they are at the back to back, but then open up and then slightly bend them, they face each other, and then you do Kapalbhati.
Yeah.
So when you do that, you are exercising your neck and shoulders, very good for frozen shoulders or shoulder pain.
Oh, wow.
So simple things which you do yourself without anybody's help, or if somebody can massage your back, it's fine. But this will self-treating, but keeping busy, not lying down. And then fibromyalgia. People say, don't touch me. They're very afraid when I touch them.
Yes.
Even if I slice touch and they
it's
really
ouch.
move out
Ouch.
and move the arm away. But I persist, and then I do a little, and then they're happy. And then when I do more, then they can bear it. It's painful, but they bear it because I touch all the nerve endings. I massage all the nerve endings. It's acupressure throughout the body. The hands, arms, legs, feet, especially feet and hands. The acupressure stimulates or causes more pain very temporarily, but then the body gets used to it. And then at the end of my session, they're happy. The pain level goes down. And so it's the experience I have to give them that it can be pain-free. You can be pain-free if you do something. It's just the brain sending the pain signal all the time. Although there might not be any physical pain, it's some sort of problem in your body which keeps sending a pain signal, although the physical pain might not be there. And then all parts of the body send it, the pain level goes to 10 because all the parts are sending pain signals together, and the volume goes up, pain volume goes up, and that's what happens.
We know that one. So
yeah. So don't be afraid. It's not, your body is not dying. It's just you have to fight it, and then this way you'll raise your pain threshold. You have to raise your pain threshold. Fight it.
So can you share any success stories, testimonials from anyone that's had fibromyalgia that you've had as a patient who has benefited from your yoga therapy as part of their pain management regime?
Some benefit just me talking to them because they are so engrossed with my talking and being engaged with me. Their brain has stopped thinking, and then they say, I'm already feel better just by talking about my pain, and I'm explaining to them. And then I do a little therapy, and then they feel better. But most of the people, because I move around and I don't have regular contact, I've seen them once or twice. But if, at the end of each session, they're all happy and they feel so good and they sleep very well. They sleep very well. the first time, sometimes 2-3 nights as well, but then slowly it comes back. So I'll see if I can have some regular, more people, and then see how far it can go. But
Yeah.
I'm trying.
No, I think what you've shared today, and thank you, it makes sense in real life of fibro life. And I resonate with what you're saying because I've had the pleasure of meeting you at an event, and it was an honor. And I would like to share that experience because the people that are joining us today and other people that will watch this, I went to Brobelbai, and yes, it was not the best of days for me, but exactly what he said. But it wasn't just about talking, but the small exercises that he has showed and shared with you today. If you implement it in your daily care, it is an absolute fantastic way of starting your day and even ending. I slept that night, and I can also share that when you were mentioning about massaging the front of the hand, and yes, to touch, it's very painful. The first time was a bit of a oh kind of a situation. And about 3 minutes into the treatment or therapy, it was like my body was from here to then slowly going down and feeling relaxed. And it's about building the trust as well. And I think whenever you do choose a therapist, it's a bit like you have to gel with them and resonate with them and build that trust and rapport with them for you to be able to then trust them to help you. Because when you're in such heightened pain, it's so difficult when somebody's not understanding what you're going through, and then they'll say something that as an individual, you then straight away give up and think, oh, I'm not going to do that again. I'd rather just cope with my pain. But that is not the answer. Brobelbai is on the Aragyam platform. So please connect with Dr. Neha and, you know, join his sessions as well. They're powerful and you learn a lot, and it's easy. I can assure you, because if I can do it, you can do it. So on that note, I would like to thank all of you for joining us today. A special thank you to Dr. Neha again for having me on this platform. And Brobelbai, thank you for joining us today. It's such an honor and a pleasure, and for all your support as well. So thank you. We will have a few questions if Dr. Neha is around, whether it's for Brobelbai or myself. Feel free to use this time. But just to let you know that the next session next week will be on the 19th of March at 6 p.m. So I'll hand it over to Dr. Neha. I don't know if she's there. Do we have any questions? I don't know where Dr. Neha is. Okay. Is there anyone got any questions?
Did anybody try the exercise and notice a pain level difference?
Yes, I've tried. Prabhubai, Jai Shri Krishna, I know you.
Jai Shri Krishna.
Remember, I've came neighborhood center.
Yes.
For the Olu. Tame Olu Sukairu tu.
Yes, I came for a few weeks.
Yes. Yeah.
I
walking
did my treatment.
If I do a lot of walking, I get leg pain. Ikene utai ratnam trop taine dukene.
Yeah, leg pain you'll get because there is a circulation, and then the muscles. Are your muscles paining?
Oh, muscle pain.
Muscle pain, leg pain, and then are you out of breath?
No.
Okay. Just do a walking and a rest in between, and do breathing while walking.
Okay, do breathing.
Yeah, get
breathing,
oxygen.
Breathe out.
You can breathe while walking, get oxygen. Basically, we
You
breathe
mean
very shallow.
breathe in and breathe out?
Yes, while walking, because we are doing very shallow breathing. We only do 2 seconds in and 2 seconds out. Automatically, the body is doing very little breathing, enough to keep your brain active. But if you get into a habit of taking 3, 4, 5 seconds worth of in and 3, 4, and then out slowly, not like that, but breathe in through the nose and out through the nose slowly. So let it all out, and then brain relaxes, and that reduces the tension. Even the slow breathing engages the brain, that brings down the stress, tension, anxiety.
Okay.
It's for the brain. You have to keep the brain happy and engaged. And if it's engaged, then it can do its other things. But if you're in pain, because brain doesn't do its background function of repairing the body, it's doing so many functions, and then you get other illnesses. So your pain, your pain goes up. Thank you.
Okay. Thank you.
Thank you.
Yeah. Sorry, I was late today. I had a visitor.
That's all right. I was late as well. Doesn't matter.
Oh.
Does anyone
These
else
are
have any
little
questions?
things. Pain
Thank
is the big
you.
thing. These are little things. Your pain is the main problem.
Yeah. That's right. Yeah.
Okay, bye.
Bye. Thank you.
Is there anyone else that has any questions for Prabhupada?
Mm.
No. Well, like I said, thank you, Dr. Neha, for having us on the platform, and for Prabhupada for joining us today, and the support, all the support that you've given us today. It's meaningful, it's helpful, and it's a good takeaway for people to implement in their daily planning. So thank you. We shall see you all next week on the 19th of March at 6 o'clock.
Neha is here.
Thank you.
Thank you.